correctly and sometimes on that screen. I'm sorry for that, but that will help to ensure you have the right screen. All right, so you see my screen, I see the thumbs going up. I'll try to delve into the next 15 minutes into ELGA and beyond, balancing all Austria's digital health priorities. The test came out because this year is the year in e-health in Austria. We just passed the e-health reform at the same time on the European level. The European Health Data Space has just been adopted, and that really means a lot of advancement also for the Austrian landscape. So let's delve into it. I'll try to outline the next 15 minutes on where I'm gonna go into which details. In the center, you see the Austrian system, ELGA, Electronic Health Record System of Austria, with the acronym of ELGA. And at the very left side, you see the European Health Data Space that will have a strong impact on all our infrastructure and all the services. And then you see the e-health reform that also had a saying in Austria. It was like the marketing term for it, putting digital before outpatient care, before inpatient care. So that's what you see here, digital before outpatient, before inpatient, referencing the e-health strategy. So delve into all of those subjects to give you an outline where we are at the moment, where we're gonna head towards with ELGA and the system because of all those great news that we're just at this stage experiencing. Okay, let's delve into the e-health strategy. I'm sure a lot of you who studied at least the Austrian system have heard about this strategy. I'm not going to go too much into detail, but what you see here is this very nice graphic on the right side, where you see this interlinked platform. You see this nice this globe that has like the antennas like a Wi-Fi that's very much connecting all healthcare institutions with the patients and their mobile apps. That's basically showing one of the strategies, one of the key visions that Austria wants to head towards as well. And this vision should come to life with 8 categories that the e-health reform really delves into and also gives us basically key performance indicators on where we need to head to. And ELGA is going to take a lot of parts in that as well. So let's look at it. We have the first 3 steps. That's all about enabling digital access to the healthcare system, and then also creating the telehealth and prevention and care solutions. And of course, further develop, and this is one of our key areas, the public health telematics infrastructure. So this public health telematics infrastructure, at its core, a lot of this infrastructure, ELGA is the base for. So this is why we really need to go into ELGA to make all of that really happen, and provide a great infrastructure to make services that are relevant for each and every patient and citizen in Austria, but also for all the healthcare providers happen. And then the next categories are provide central e-health services and components. This is what I talked about. With e-health services, I talk about making, for instance, a patient summary reality in Austria, but also having digital services like telehealth services up and ready for patients. And then we have established registers relevant to healthcare. You don't really see here the full screen. So what is written behind it is established registers relevant to healthcare and governance. What we mean with that in Austria is to come up with data registries and to further support the whole healthcare pathways we have up and ready in Austria and will build in the future. That also means a better access to data for research. Then we have strengthened secondary use of health data. So this is all about building this research infrastructure. Then we have make innovation accessible and strengthen digital skills. So something that we really want to concentrate in Austria as well, that I'm not going to delve into too much in this presentation, is really going into the nitty-gritty part of strengthening digital skills, digital literacy within the Austrian population. That's also one of the core pillars of the e-health strategy. But to understand that further, where we are at with ELGA, let's go into some details where we are standing, what ELGA can do up until now. So what ELGA really is, we are a secure exchange platform for health data for multi-professional collaboration. So what ELGA really did is structure data throughout all the Austrian healthcare system and providing access for all the healthcare institutions to exchange data as well. That all can happen due to the role-based access that we already have implemented in Austria. So this is something ELGA can do at the moment already. And we can grant access to data during a treatment contact at this very stage. In Austria, up until now, we have an opt-out system. I'm sure most of you are familiar with this term. So that means you can opt out of the whole infrastructure. In Austria, only 3% opted out of the whole system, so 97% are in. What ELGA also does now is really standardizing data. So what we're doing, we have a whole team that is collaborating with all the landscape in Austria, with all hospitals, with all healthcare providers, but also with um, all the whole industry factor who is like cooperating to make sure we can actually digitalize the whole landscape. So what we're doing, we're sitting together and trying to standardize, let's say, one of the reports that a hospital, for instance, like in a hospital discharge setting, would give to the next healthcare provider. So by standardizing this, we make sure that all the terminology that's used within Austria is the same, but also the way how a report is looking is the same. So this is all about interoperability. This is what we're doing right now. And with the very right building blocks that you see, that's something ELGA already did. What we also do is that the content is at this stage only provided by healthcare providers. So whenever data is entered to the ELGA system, only healthcare providers enter this at the moment. I'm pointing that out because in a few minutes, we're going to delve into the European health data space that already gives the outlook that something about that will probably change. So then let's look into what ELGA can do at the moment in terms of which documents are actually in ELGA at this moment. We have this very right building blocks that you see. We have image data, we have e-reports, we have e-medication data, what's basically e-prescription data, and we have e-vaccination data within our infrastructure. And we also have central applications that are able to summarize data. And the whole image data, that's something I pointed out here, is something that's quite new. So we have image reports since a long time, but very newly, since this year, we also have the true images within ELGA. It's a pilot we're doing at the moment, and that works quite well up until now. Okay, so I showed you what we're doing right now. Let's look into the figures of where we are at. I already told you the very up part here. It's 97% of the citizens are within the ELGA infrastructure. So only 3% opted out. For Austria, that means approximately 280,000 people out of 9.1 million. We have 100% of all the public hospitals annexed to the ELGA system. Pretty much all pharmacies annexed to the ELGA system, and we have 85% of all the public offices of doctors' offices also connected to the ELGA system. On the very left side here in the orange box, you see some of the milestones when ELGA GmbH, our company, has been founded, and also when we went live. So there is quite some history within Austria. So we built on a very successful infrastructure. And what we really need to get into is bringing services to life, bringing services to the people, and bringing more services also to the healthcare providers. So this is everything that you can see in the e-health reform that we concentrate on as well. Here on the very bottom in the orange boxes, you see some very impressive numbers, how many data is stored within ELGA. Yeah, it's just, you know, all the infrastructure of Austria. So that also means, of course, a huge amount of data that flows through the system. Let's summarize what we have at the moment. At the moment, after all those years of ELGA, we have citizens that trust ELGA. We had a big survey that in just last year, where we found out that there's a huge trust level within the ELGA infrastructure. There hasn't been data leakage, so that's great. We can build on that. At the same time, the citizens really expect more data to be within the infrastructure. That's something that also the eHealth reform really asks us to do as well, and that's good. So ELGA, and that is part of what I just said, is currently still incomplete. We do have missing data, we do have missing findings, something we really need to complete now to make the best of the use of the whole infrastructure. And that brings me to the third point. ELGA up until now is still underutilized. So we have a great infrastructure, but some of important healthcare providers are not yet connected, and a lot of information is still missing for a complete overview. So we really need to get going with services and completing the whole system. And then we have the next point, also a status quo. We do have at the moment, and we're very proud of that because not every other European country has that at this stage. We have a very deep integration into our healthcare providers' IT systems. So all our healthcare providers in Austria work with their own IT systems up until now, and that system is connected with our infrastructure. So also all the whole eHealth landscape is really deeply integrated and something that we need to keep going, because that's something that is very important to make the best use of our system. And then in order to obtain a quick overview of relevant health data, we have a centralized processing of structured data. That's very helpful. We have seen that with the e-vaccination record, for instance, something that worked really greatly. And that's also something that the patient summary, that's one of the future services we're going to dig into, should focus on. All right, so let's look into the vision. Where do we head? We head towards a modern and secure infrastructure. We still want participation to be voluntary. We want to be the central platform. ELGA makes it easier for healthcare providers to access all relevant health data. And the use of ELGA brings a recognizable benefit and added value to healthcare providers and citizens. So that's something we're going to focus on. And ELGA data is also, of course, available for treatment in other European countries. That's the vision where ELGA needs to head to, with the mission to complete the healthcare record, to access, give access to all healthcare providers, and to, of course, always look out for data security, high data protection. Easy and low threshold access for citizens is also something that we need to get going, to have, you know, a low-key app that connects all the healthcare providers, but also the patients and citizens in Austria, and to use standards. So now let's delve into just very small moment into the EHDS. So if we go into EHDS, we basically travel to Europe, and there are some problems that the EHDS is focusing on: access and control over your own data. Okay, yeah, access and control over your own data. Doctors and healthcare providers access primary data, but also making data accessible for research and for policy, and lowering market barriers. That's something the EHDS, a regulation that just has been adopted, really delves into. Just by looking at these points, you can already guess that a lot of those points basically are exactly what ELGA has planned already, and it's very compatible with each other. And that's also what we're analyzing at the moment. And that's what needs to be changed in ELGA in order to be compliant with this new regulation. Focusing on this scope that the European Health Data Space brings, the use of health data, MyHealth.eu it's called, we find out that there is quite some comparability between our systems. So, but let's look into very shortly what needs to be changed. In the primary data use on the European level, there is all those points listed here. You can also read that afterwards. That's going to be changed. And let's just start from the top to the bottom. So we have priority categories that must be registered electronically in all the EHR systems. And that's something we already do. We're going to delve into which priority categories are in there. And then we need to identify the patients, all of them, and we also need to identify the healthcare providers. What marks My Health Edu newly is that all those people, citizens and healthcare providers, need to be identified with a European identity. So in Austria, it's called EID, and that's something that we need to be implementing. Some of that already has been implemented, not all of it, and that's something we need to change quite quickly. Another thing that's going to come up is that patients can contribute their data themselves. So something that I pointed out very early on in this presentation, we as patients all over Europe will be able to contribute with the data in our own EHR systems. So that's something we really need to look into, something that the ELGA system at the moment doesn't provide, and that's something will be able to provide very soon to be compliant. So putting that together, let's delve into the priority categories, and then you'll see that we already mentioned a few of them that are already live and up and running in Austria. What the European Union now asks us to do is come up with 5 core services. The first service is the patient summary. The second service are electronic prescriptions and dispensations, or levies. Then we have the medical images, lab results, and we have discharge reports. So looking at the priority categories, I can already tell you ELGA does pretty much all. Just one thing is missing. It's the patient summary files. And that's why we, in the very future, going to concentrate on patient summaries as well. You also find that written down in the eHealth reform and in the eHealth strategy. All other categories, we are quite advanced with it, but there will be quite some change as well. Why will there be quite some change? In order to make this European infrastructure reality, there is one thing that needs to be done. And that one thing is having the same format all over Europe. So each and every member state is now asked to take their services and connect it to this very new exchange format. It's called the European Health Exchange format. And that will be implemented throughout the next years. In the next slide, we'll look into when the EHDS is actually going to come to life and what the European Union asks us to do. So you see here a very strict timeline. At the moment, European Health Data Space has already been adopted. What's still missing is the legal text that is implemented, that is translated to all the member states' languages. Once they are ready and approved, that we will either end of this year, as you can see here, or the beginning of next year. This whole timeline starts to be lawfully integrated to the whole European region. So we're gonna have 2 years to be ready with the general application. What's in there is something like the 2-factor authentication for healthcare providers. What's in there is to also build new authorities that will make this EHDS a reality. And then the blue pillar, it's the primary use pillar. We can now see in 4 years' time, all member states need to be connected to this huge infrastructure, and all countries need to have implemented the patient summaries in their own countries, but also in a cross-border use, and the electronic prescription and electronic dispensation. In 6 years' time, we're gonna have medical images and medical test results, as well as the discharge reports, all implemented. So for us in Austria, it's a big challenge to come up with exactly that time frame, because only in 2027, in the beginning of 27, we'll probably have the European exchange formats ready. And that's why it's gonna be quite some challenge. But it also gives you the overview of where we as a whole infrastructure are gonna go into. I'll try to summarize because the time has already been passing quite fast in one slide for you. Rethinking eHealth. So the EHDLs will introduce the European exchange formats and initiate a market harmonization, because all the IT systems that are out there are only allowed to be on the market if they have implemented exactly those exchange formats. So we'll have a harmonization. That's something we'll see. And of course, also our infrastructure, ELGA, will be compatible to it. Then what's next? The eHealth reform prepares and completes the missing pieces of our ELGA mosaic. So we'll connect the missing healthcare providers. We complete the health data. We have central functions and user-friendly summaries. We're going to map workflows and direct notifications. And we're going to have finally diagnosis ready in a SNOMED CT within ELGA, in this SNOMED CT format. Yeah, and then of course, ELGA will make a significant contribution to digitalization and networking in the healthcare sector. And us as a whole company, ELGA as a company, will really be expanded to become the central institution for all joint eHealth projects of the federal government, the provinces, and the social insurance funds in Austria. By that, I want to close this session, and I'm happy to answer all your questions that are coming up, and happy to be here. And I hope I could give you a good overview of ELGA, of how our eHealth reform is gonna change ELGA, and also where we're gonna head to with the EHDS.